Not in the mood yet? Totally normal. After birth, your hormones shift, sleep is light, and your body is still healing. Desire often shows up last. I'm Cherry, a maternal and newborn nurse, and I want you to hear this clearly. Intimacy should feel safe and unpressured. Stay with me, and I'll show you how to decide when you're truly ready. Make first attempts comfortable and set up birth control before your period returns, so you can ease back into connection at your pace with comfort as the guide. If you've heard, just wait 6 weeks, you deserve a better answer than a calendar date. Your body isn't a stopwatch, it's a healing tissue, shifting hormones, a recovering pelvic floor, and a tired but amazing brain that's doing the work of a night shift and a day shift at the same time. By the way, if you like checklists that keep things simple, I made a free guide called Simply Postpartum. It's a recovery checkpoint list. What's normal versus when to call. You'll find it below. Let's start with the real answer to when can I have sex again? There isn't a universal rule. Clinically, many providers suggest waiting until you've had a check-in around 4 to 6 weeks. But the better framework is this. Has bleeding settled? Are your stitches or incision healed and comfortable? And do you feel physically and emotionally ready? If you can say yes to those, you can begin gently and on your own timeline. Big picture. There is no requirement to hit a specific week. Readiness matters more than the calendar. Here's why the 6-week mark gets repeated so very often. The uterus and vaginal tissues are still healing, and the cervix has been opened. While lochia is ongoing, there's a higher infection risk with anything entering the vagina. Many clinicians, therefore, recommend avoiding vaginal penetration until bleeding is finished and you've had a quick all is well check. If you were told nothing in the vagina for about 6 weeks, that's the safety logic behind it. If you're unsure where your own healing stands, schedule a brief exam. It's reasonable to ask your provider to actually assess comfort, not just glance at the calendar. Now, let's talk about why sex can feel different for a while, especially if you're breastfeeding. Estrogen is lower in the early postpartum period and during lactation, and that can cause vaginal dryness and tenderness. There's nothing wrong with you. It's hormone physiology. Generous lubricant plus more arousal time will help, and many moms do well with a daily vaginal moisturizer. If dryness or pain sticks around, ask your doctor about low-dose vaginal estrogen. This is not the same as taking estrogen pills, and consider a referral to a pelvic floor physical therapist. They're the specialists who help with painful sex, scar tenderness, pelvic heaviness, and muscle coordination after birth. You deserve comfort, not push through it. Positioning and pacing matters. In the very beginning, I like to suggest starting with intimacy that isn't about penetration at all. Touch, closeness, and communication rebuild confidence without putting pressure on your healing tissues. When you are ready to try penetration, choose positions where you control depth and pace. Side lying is gentle. Being on top gives you control. And anything that puts direct pressure on a fresh perineal scar may need more time. If something stings, burns, or feels sharp, your body is giving you a clear, not yet. Pull back, reset, and try again in a week or 2. Before we go further, we need to address pregnancy spacing and contraception because this one surprises a lot of people. You can ovulate before your first period returns. That's why no period yet isn't reliable birth control. Non-lactating people have documented ovulation as early as the 4th week postpartum. And public health guidance in the UK notes you can become pregnant again from about 3 weeks after birth. If you're not planning another pregnancy right away, bring up contraception before you resume sex. The good news is you have several safe, smart options. IUDs and the implant can be placed right after birth or at your postpartum visit and work well during breastfeeding. Progestin-only method like mini pill, shot, implant, and many IUDs are compatible with lactation. Combined estrogen progestin methods, the pill, patch, ring, these are usually delayed until several weeks postpartum due to clot risk and if you're breastfeeding to protect milk supply. A common recommendation is to wait until about week 5 if breastfeeding and at least 3 weeks if not breastfeeding and you have no clot risk factors. Condoms are always an option and protect against STIs or sexually transmitted infection. If you want to use LAM, the lactational urea method, it can be highly effective in the first 6 months only if all 3 conditions are true. You're fully or nearly fully breastfeeding, you haven't had any bleeding that looks like a period, and you're under 6 months postpartum. If any of those change, you need another method. Talk with your provider and pick what fits your goals and feeding plans. Quick reset and a soft reminder. If you want the simple prompts for healing milestones, conversation starters for your checkup, download Simply Postpartum below. It's free and it's written exactly for you, so you don't have to memorize anything mid-sleep deprivation. Okay, let's circle back to comfort. If intercourse hurts, that's data, not a dare. Pain can come from surface sensitivity at a perineal scar, muscle guarding in the pelvic floor, or the dryness from low estrogen. If pain keeps showing up, ask your doctor, your OBGYN, or your midwife for an actual pelvic exam. So what about C-section? Even without a vaginal birth, your pelvic floor supported pregnancy for months and still can be tight, weak, or uncoordinated. Your abdominal wall and incision are also healing. Give yourself permission to go slowly. Support your abdomen with a hand or a pillow in the first attempts and use the same comfort rules. If you notice pulling, burning, or numbness around the scar that makes the intimacy uncomfortable, pelvic floor physical therapists also treat cesarean scar mobility, so tissue glides instead of tugs. If you get a green light at your visit, but your body says, not yet, the visit is not the boss. Your comfort is. I also want to validate the emotional side. Libido is a hormone story, a sleep story, and a stress story. In the 4th trimester, desire often lags. Not because you love your partner less, but because your brain is constantly on keep the baby alive mode. Start with small connection rituals that aren't sexual. 10 minutes of uninterrupted conversation, a long hug, a shower alone while your partner does bedtime. As your sleep consolidates and your body feels safer, desire usually follows. If mood changes, anxiety spikes, or past trauma are in the mix, name them with your provider. Sexual health lives downstream of mental health, and both are treatable. Let's make a quick plan you can follow without overthinking it. First, let bleeding finish and let your provider check healing if you are unsure. Second, start with non-penetrative intimacy for a week or 2. Then try gentle positions where you control depth and pace. Third, use lube early and often. If dryness persists, ask about vaginal estrogen. Fourth, set up contraception before you resume penetration. Choose what supports your feeding plan and your spacing goals. Finally, if pain, fear, or pelvic heaviness keep getting in your way, ask for pelvic floor PT. You are not broken. Your body just needs specific support after a big athletic event called. Before we close, red flags to call about now. New heavy bleeding after sex, a foul odor with fever or pelvic pain, sharp or worsening pain at a scar or the incision, or pain with any attempt that doesn't improve week to week. Those are not wait it out situations. Reach out and be seen. Your timeline is personal. Some people feel ready around 6 to 8 weeks. Others need months. Both are normal. Your only job is to listen to your body, move at your own pace, and get help if something feels off. If this was helpful, download Simply Postpartum. The link is below. And share this with a friend who's quietly Googling and wondering if she is behind. You are right on time. Thanks for spending time with me today, and don't forget to hit that like button if you find this video helpful. I am Cherry, and I will see you in the next one.